Hey everyone, in this video I will teach you all the values that NCLEX loves to test on. I will go over these lab values in an alphabetical order. I suggest that you make flashcards out of this. So the first one is activated partial thromboplastin time, APTT. The normal lab value is 20 to 36 seconds. This test evaluates how well the clotting sequence is functioning in the body. It is most commonly used to monitor heparin therapy and screen for coagulation disorders, bleeding disorders. Then the next lab value is albumin. 3.4 to 5 grams per deciliter. Albumin is a main plasma protein of the blood, and it maintains osmotic pressure. It transports fatty acids, hormones, medications, and other substances that are not soluble in water. The next one is alkaline phosphatase, 4.5 to 13 units per deciliter. Alkaline phosphatase is an enzyme normally found in bone, liver, intestine. The levels rise during the period of bone growth, liver disease, and bile duct obstruction. So when alkaline phosphatase is high, you will think liver disease, bile duct obstruction. Then ammonia. The normal level is 35 to 65 micrograms per deciliter. Ammonia is metabolized by the liver. It is excreted by the kidneys as urea. It is a waste product from nitrogen breakdown during protein metabolism. And elevated levels indicate hepatic dysfunction, such as encephalopathy. Then the next lab is amylase. Amylase, the normal range is 25 to 151 units per liter. Amylase is an enzyme produced by the pancreas and salivary glands. It assists in digestion of complex carbohydrates and is excreted by the kidneys. In acute pancreatitis, the amylase level is greatly increased, and it is a good diagnostic tool for disease processes. Then bicarb. Bicarb, the normal value is 22 to 29 MEQ per liter. Bicarb assists in acid-base balance. So it helps maintain the pH of the blood. Bicarb. Bilirubin. The bilirubin normal value is less than 1.5 milligram per deciliter. So bilirubin is produced by the liver, spleen, and bone marrow, and it is also a byproduct of hemoglobin breakdown. So total bilirubin levels rise with any type of jaundice, whereas direct and indirect levels rise depending on the cause of the jaundice. So depending on the cause of the jaundice, bilirubin levels will rise. If there's breakdown of the RBCs, the patient will develop that yellowish tinged, the jaundiced look, and we check for bilirubin levels, and they're usually high. Then the next one is BUN, blood urea nitrogen. The normal range is 8 to 25 milligram per deciliter. BUN is a nitrogen protein of urea, a substance formed in the liver through an enzymatic protein breakdown process. So BUN is 8 to 25 milligram per deciliter is the normal value. Then we look at glucose tolerance tests. One second. Then we look at glucose tolerance tests. Glucose tolerance test is a test that is diagnosed to diagnose diabetes mellitus if the glucose levels peak higher than normal at 1 or 2 hours after ingestion of the glucose drink, of the sweet drink. They're given a certain amount of carbs And if the glucose levels peak higher than normal after 1 or 2 hours of ingestion, then the diagnosis of diabetes mellitus is confirmed. Then glycosylate hemoglobin, glycosylated hemoglobin, 4 to 6%. Glycosylated hemoglobin is the blood glucose bound to hemoglobin. So hemoglobin A1C is a reflection of how well blood glucose levels have been controlled prior to the test for up to 4 months. So we want to make sure that when we do this A1C testing, we look for the number gives us an indication of how the glucose control has been for past few months. 4 to 6% is the normal value. Hemoglobin and hematocrit. Hemoglobin in adult male, the normal range is 14 to 16.5 grams per deciliter. In adult female, the normal value is 12 to 15 grams per deciliter. Hematocrit for adult male is 42 to 52%, and for adult female is 35 to 47%. Hemoglobin is the main component of erythrocytes, of RBCs, and is the main vehicle of transportation of oxygen. Hemoglobin is important in identifying anemia. Hematocrit is the red blood cells mass and is an important measurement in identification of anemia and also polycythemia. Then the next one is INR, International Normalized Ratio. So 2.2 to 3 for standard warfarin therapy, and 3 to 4.5 for high dose warfarin therapy. These INR measures, this ratio of INR, this lab value tells us the effect of oral anticoagulants. How are the warfarin or the anticoagulants that the patient is on, how well are they working? Then the next one is lactated dehydrogenase. Lactated dehydrogenase. The normal lab value for this enzyme is 140 to 280 units per liter. LDH is an isoenzyme that's particularly affected with acute MI. So LDH levels begin to rise 24 hours after the MI, and they peak in 48 to 72 hours, and then they return to normal. So lactate dehydrogenase lab value is tested when we suspect MI in a patient. The value of this lab goes up for the first 24 hours and then it comes back down. So the next one is lipids. So for lipids, so let's do, before we move on, let's do calcium, chloride, CKMB. Okay, calcium, the normal value is 8.4 to 10.2 milligram per deciliter. Calcium aids in blood clotting by converting prothrombin to thrombin. Calcium is the cation that is absorbed into the bloodstream from dietary sources and functions in the bone formations, nerve impulse transmission, and contraction of myocardial and skeletal muscles. Then chloride, the normal value is 98 to 107 MEq per liter. Chloride is a hydrochloric acid salt that is most abundant in extracellular fluid. So the most abundant salt or cation in the extracellular fluid is chloride. Chloride functions to counterbalance cations such as sodium and acts as a buffer during oxygen and carbon exchange in the red blood cells. So chloride, it functions as a counterbalance to the positive because chloride is negatively charged. It functions as a counterbalance to cations. So chloride is an anion which has a negative charge. It functions as a counterbalance to positive to cations like sodium and acts as a buffer. CKMB, 0 to 5%. So CKMB is an enzyme that is mainly found in the cardiac muscle. The next one is clotting time, 8 to 15 minutes. This factor is the time required for the interaction of all factors involved in the clotting process. Then creatinine kinase, 26 to 174 units per liter. Creatinine kinase is an enzyme found in muscles and brain tissue that reflect tissue catabolism resulting from cell trauma. This test is performed to detect myocardial or skeletal muscle damage. So creatinine kinase is high when we suspect, if creatinine kinase is high, we suspect tissue trauma, myocardial damage, skeletal muscle damage. Then erythrocyte sedimentation rate, 0 to 30 millimeters per hour. So erythrocyte sedimentation rate is the rate at which erythrocytes settle out of the anticoagulant blood in an hour. It's not diagnostic of one particular disease, but it's an indication that there's a disease process going on in the body. That is why it's taking so long for the erythrocytes to settle out of the anticoagulant in the blood. And then fasting blood glucose, the normal range of fasting blood glucose is 70 to 110 milligram per deciliter. Glucose is the monosaccharide found in fruits. It is formed from digestion. It is formed from digestion of the carbohydrates. And fasting blood glucose levels help us in diagnosis of diabetes mellitus or to detect hypoglycemia. Now, then let's talk about lipids. Now, cholesterol, 140 to 199 milligram per deciliter is normal. Low density lipoprotein, LDL, less than 130 milligram per deciliter is acceptable, is normal. High density lipoproteins, which is HDL, so 30 to 70 milligram per deciliter is the normal range. Then triglycerides should be less than 200 milligram per deciliter. So lipid assessment includes total cholesterol, low density lipoprotein, then high density lipoprotein and triglycerides. So when we send a lipid panel, we test for all of these. And it tells us, if the diet is off, is composed of high fatty acids and processed foods, then the triglycerides will be high, and it indicates how much plaque would possibly be building up in the arteries if the blood is already so saturated with cholesterol and triglycerides. Then the next one that you need to also know is magnesium. Magnesium, the normal range is 1.3 to 2.1 milliequivalents per liter. Magnesium is used to determine the metabolic activity in renal function. It is needed in blood clotting mechanism, and it regulates neuromuscular activity. It acts as a cofactor that modifies the activity of many enzymes and affects the metabolism of calcium as well. Then the next one is platelet count, 150,000 to 400,000 cells per milliliter. So platelets are produced in the bone marrow. The function is to form the homeostasis plug formation when there's a bleed, the clot retraction, coagulation factor activation. So platelet helps in formation of the homeostatic plug, in clotting of the blood, and also helps in coagulation factor activation. Then the next one you need to know, next lab value that you need to know is potassium. 3.5 to 5.1 MEq per liter. Potassium regulates cellular water balance, electrical conduction in the muscle cells, and acid-base balance. Potassium, the body obtains potassium through dietary, The body obtains potassium through dietary ingestion, kidney preserve or excrete potassium depending on cellular needs. Potassium also plays a huge role in repolarization of the heart cells. You can use this information to assist in understanding of the ECG reading. Then protein, 6 to 8 grams per deciliter of protein should be present for normal value. Protein reflects the total amount of albumin in globulins in the serum. So protein regulates osmotic pressure and comprises coagulation factors for homeostasis. So protein helps build the coagulation factors for homeostasis. Protein builds the enzymes, the hormones. Protein is responsible for tissue growth and repair, and pH buffers. The loss of protein causes the fluid to shift from vascular area to the tissues. So this shift could cause ascites, edema, fluid buildup in the lungs that cause crackles. So we need to have 6 to 8 grams per deciliter of protein in our serum so that the body can carry out the functions as needed. Then we talk about PT, prothrombin time, PT. Adult male 9.6 to 11.8 seconds, adult female 9.5 to 11.3 seconds. Prothrombin is vitamin K dependent glycoprotein produced by the liver. It is necessary for formation of a fibrin clot. So each lab establishes a normal value based on their own method, but typically the normal time, PT time, prothrombin time, measures the amount of time it takes for the clot formation and is used to continue to monitor response to Coumadin therapy or to screen for a dysfunction of the liver, vitamin K deficiency, or disseminated intravascular coagulation. The value within 2 seconds plus or minus the control is considered normal for PT. Then the next one is RBC. Adult male value for RBC is 4.7 to 6.1 million per mm3 cube. So, and for adult female is 4.2 to 5.4. So RBCs show this test shows us how many red blood cells are in the body, and a decreased number of RBCs could show, a blood loss or the body is anemic. Then the next one you need to know is serum creatinine, 0.6 to 1.3 milligram per deciliter is the normal value. An increased level of creatinine indicates a slowing of the GFR, slowing of the kidneys, slowing of the glomerular filtration rate, and is an indication of renal function. Then the next one is serum iron. Adult male 65 to 175 micrograms per deciliter is normal, and for adult females 50 to 170 micrograms per deciliter is common. Iron is mostly found in hemoglobin. It acts as a carrier of oxygen from lungs to the tissues and acts indirectly in the return of carbon dioxide to the lungs. So iron basically aids in carrying the oxygen to the tissues, and it helps. If the iron is low, we know the patient is anemic, they may have hemolytic disorders as well. Then serum sodium. The normal value is 135 to 145 milliequivalents per liter. So this is one of the more important electrolytes. Sodium maintains osmotic pressure and acid-base balance and assists in transmission of nerve impulses. Then the next one you need to know is thyroid stimulating hormone, 0.2 to 5.4 mu units per ml. Thyroid studies are performed if a thyroid disorder is suspected, if the patient is reporting sluggishness and all the different symptoms, signs and symptoms of thyroid being off are there. So then the practitioner will send out a TSH test, and this thyroid study is performed if a thyroid disorder is suspected. They're helpful to differentiate between primary thyroid disease from secondary causes. So that's TSH. Then the next one is troponin. Usually it's less than 0.6 milligram per ml. So increased amounts of troponin are released into the bloodstream when an infarction causes damage to the myocardium. Greater than 1.5 milligram per ml is indicative of a possible MI. So if the troponin levels are greater than 1.5 milligram per ml, that means the patient might have had a heart attack. Then the next one that we're going to cover is uric acid. Let me make sure I'm not leaving anything out. The next one we're going to cover is uric acid. Uric acid, adult male, is 4.5 to 8 milligram per deciliter. For adult female, uric acid level is 2.5 to 6.2 milligram per deciliter. Uric acid is formed as purines, adenine, and guanine. It's metabolized continuously during the formation and degradation of DNA and RNA from the metabolism of dietary proteins. So elevated amount of uric acid deposits in the joints and soft tissues. That's when it causes gout. An elevated amount of uric acid in the kidneys can cause urate stones. So stones can be formed from uric acid, excessive uric acid. Then WBCs, so 5,000 to 10,000 cells per MCL. WBCs this test shows us how many white blood cells are in the body. If there's an elevated number, if there's an increase of WBCs, that shows us infection. And if there is a decrease, then that indicates that the body is at risk for infection. So if the WBCs is high, that means there is an infection and the body is fighting. If the WBCs are suppressed, that indicates that this person might be at risk for picking up an infection. So potassium, we did potassium. Potassium is one of the important ones as well. 3.5 to 5.1 milliequivalents per liter. Potassium regulates cellular water balance, electrical conduction in the muscle cells, acid-base balance. The body obtains potassium through diet. Kidneys preserve or excrete potassium depending on the need of the body. Potassium plays a huge role in repolarization of the heart cells, right? So we talked about that, and NCLEX loves to test on potassium as well. So these are some of the most common lab values that NCLEX loves to test on. I would suggest that you make flashcards out of these lab values and add to them as you study and prepare more for your NCLEX. Follow me for more NCLEX prep classes and live videos. Good luck.